My name is Mike Kirlew. I'm one of the physicians in the Sioux Lookout region. I work up in Wakepeka, Ontario, and I work in Sioux Lookout.
When you came to the north, what did you think the first time?
I remember just being like, wow, this kind of existed, and this sort of apartheid system existed, and it was kind of under my nose for all those years. You didn't even really see it. I remember not really learning about it in school. I didn't know for years that they had hospitals for Indigenous people and different hospitals for everybody else. You kind of get a crash course of that when you come to this region. All right. How are you doing? Yeah, doing good. It's good to see you today. Yeah, how's Joshua been doing and stuff?
He's been doing okay.
Yeah, he's been doing okay. Mm-hmm. When I look at what people are asking for, a lot of times it's basic stuff. I have my kid can't talk. Can they get access to some services? I'm looking after my relative or family member, and I need some home care. I need somebody to help me out. Can I get some services? And you know what? And you know what's interesting, because you know, when you contrast that to what's available in the provincial system, it's like night and day. You know, as a practitioner, I work in that provincial system as well. I work in the other system, the system that other Canadians enjoy. And the level of care that my patients get here is just far inferior to what other Canadians enjoy.
What can you tell me about Wakepeka?
I've been going up there for 11 years now. It's a community that has had significant challenges, but it's also a community that I've seen some of the finest examples of humanity that I've ever encountered in medicine, in my medical career. I love going up there. So you feeling good today? Yeah.
Is this a well-equipped medical station?
I don't think it's equipped as well as it should be, right? I think that, you know, communities make the best attempt to equip the nursing station, you know. Community has gotten extra equipment and supplies, but, you know, we could always be better, right?
Do you have an X-ray machine?
No. A lot of communities don't, and a lot of the communities that do, they're not working, or they're broken, or those types of things. How's our man doing today? Whooshoe.
He just woke up.
He just woke up?
Yeah, he's sick right now.
Oh boy, he's feeling pretty sick, eh? I love the work. I love the people. I see every day examples of hope. It's a powerful place. It's a very powerful place.
Do you forget that this isn't normal, ever?
I think that's a real temptation, right? You can, you forget what normal is. You have to remind yourself what normal is. You know, that's part of the fight, or that's part of the battle. It's just not succumbing to the status quo, right? Continuing to fight. My patients do not receive anywhere close to a comparable level of care that other Canadians would enjoy. They just don't. Like, we have a system in this country that triages people based on race to inferior care. That's the height of un-Canadianness. We're a country that espouses equality and equity and fairness. This is not fair. How do you find Donnie has been doing?
Well, the right side.
Yeah.
You can't
always move as well. Yeah.
Yeah, like he can't feel.
Yeah, yeah.
Especially on his foot.
Yeah,
He gets cold too.
Yeah. On that right side and stuff, yeah. Because that's the side that was weaker after the aneurysm.
Yeah.
Yeah.
Like he can't feed himself.
He needs help to, yeah. Do you get a lot of help, like?
No, it's just me.
It's just you,
and my girls.
Yeah.
Do you think you help people here today?
You know, they have this phrase in medicine called the Hippocratic Oath, right? We take it when we graduate from medical school, right? It says to do no harm. And You know, sometimes I view my role as a physician, sometimes is to minimize the harm that the system is automatically doing to people. So maybe I'm a harm minimizer. Do you find she's improving?
Yeah, she's improving.
That's good. That's good.
Do you believe things can change?
I do. That's hope, right? Hope is belief that things can change.
And what's at stake if it doesn't?
Lives. That's what's at stake, lives. If things don't change, more people are going to die.